Welcome to another Explainer. Today, we're diving into a side of healthcare that is frankly absolutely life-changing. We're talking about rehabilitation nursing. This isn't just about handing out medication or treating an illness. It's about that incredible, sometimes grueling, but ultimately inspiring journey of helping people get their independence back.
To really wrap our heads around why this is so crucial, I want you to just imagine something pretty terrifying for a second. Imagine waking up tomorrow and you literally can't dress yourself. You can't eat your own breakfast. You can't even take a shower on your own. How upside down would your life be? It would completely shatter your daily routine, your dignity, your whole sense of who you are, right? Well, that's the scary reality millions of people wake up to after a severe illness or a major injury.
In the medical world, there's actually a specific term for these basic fundamental tasks. We call them activities of daily living, or ADLs for short. These encompass all those vital self-care routines that most of us barely even think about. Bathing, grooming, throwing on a shirt, eating, toileting, the whole bowel and bladder tear shebang. When a medical event suddenly strips those abilities away, rehabilitation nursing is the specialized, hardcore field that steps right in to help pick up the pieces.
So, here's our roadmap for today's Explainer. We're going to hit impairment versus disability, the main goals of rehab, a few specialized programs, the multidisciplinary team, and finally, the nurse's specific role in all of this.
Section 1. Impairment versus disability. Let's get these terms straight. There is a really sharp distinction to make right out of the gate here. An impairment, that happens strictly at the anatomical or organ level. It's an abnormality or a loss of function. Think dysphagia, which is when you have trouble swallowing, or hemiparesis, where one side of your body goes weak. But a disability, that happens at the person level. It's how that physical impairment actively stops you from doing normal things, like walking down the street, communicating with your family, or just brushing your hair.
Now, to put that real-world impact into perspective, disabilities are classified into 4 distinct levels, mostly based on how they affect someone's ability to work. So at level I, you've got a slight limitation, but working is usually still totally fine. Level 2 is a moderate limitation, so you might need some modifications at your job, but then you hit level 3, which is a severe limitation where working is completely off the table, all the way down to level 4. And level 4 is total disability, meaning you are practically entirely dependent on others for basic survival.
Okay, moving on to Section 2, the goals of rehab. How do we actually restore that independence?
Well, the World Health Organization actually gives us a phenomenal definition here. They describe rehabilitation as the combined and coordinated use of medical, social, educational, and vocational measures. Now, pay attention to those words, combined and coordinated. It's not just one quick fix, it's a massive, multifaceted attack plan to get someone back to their absolute highest possible functional ability.
And that massive effort, it's basically built on 3 main pillars. First up is restoration. That's fighting tooth and nail to get back the exact abilities that were lost. But if that's not 100% possible, we pivot to maintenance, which is fiercely protecting whatever abilities the patient still has. And finally, promotion, pushing the boundaries to help them achieve their absolute highest level of overall well-being, whatever that looks like for them.
So rehab is usually about getting old skills back, right? But what happens when that's just not an option? That's where this fascinating concept comes into play. Habilitation. It literally means making able. Instead of looking backward, it's brilliantly focused on learning entirely new skills and new ways of adapting so the patient can reach their maximum potential when the old ways are permanently off the table. Section 3. Specialized rehabilitation. Let's look at some tailored recovery plans. So, physical and neurological rehabilitation is really targeted at folks whose lives have been flipped upside down by severe trauma. Things like a stroke, a progressive neuromuscular disease, or a spinal cord injury. And the end game here isn't just about getting a limb to move again, it's about making the patient truly self-dependent again, elevating their life, not just physically, but emotionally and socially too.
But hey, we have to remember rehab isn't strictly for physical trauma. Drug and alcohol rehabilitation are incredibly critical fields. They're designed to literally free patients from the absolute grip of addiction. It combines highly structured detox programs with crucial education on the devastating physiological effects these substances are having on their bodies.
Honestly, the whole umbrella of rehabilitation is just incredibly wide. It covers cardiac recovery, where you're teaching heart attack survivors about risk factors like high blood pressure and stress management. It covers vocational programs that are entirely focused on helping people get back into the workforce after a major disability. There's even vestibular rehab, which is wild. It works to correct inner ear deficits so people don't lose their balance or hand-eye coordination. Moving right along to Section 4, the multidisciplinary team. This is a massive collaborative effort.
Because in this ecosystem of care, you don't just have one single doctor calling all the shots, not even close. The patient and their family sit right at the epicenter of this huge collaborative wheel. Surrounding them is an absolute army of specialists. You've got neurologists, occupational therapists, speech therapists, social workers, dietitians, psychologists, physiotherapists, all communicating and working in complete lockstep. Which brings us to Section 5, the nurse's role, the true central hub of the team. To keep this whole operation running smoothly, a rehab nurse relies on a really precise 4-step battle plan. They kick things off with an assessment, figuring out the patient's baseline and exactly where the gaps are. Next is planning, which means building a customized roadmap right alongside the family. Then comes implementation. That's the hands-on execution of care and actually teaching the patient self-care strategies. And finally, evaluation, where they're constantly monitoring the progress and tweaking the plan as the patient heals and evolves. But what really sets these nurses apart are their incredibly intimate, specialized, hands-on skills. We're talking managing mobility to prevent dangerous falls. We're talking bowel and bladder training, ensuring a patient can safely swallow their own food without choking. But honestly, one of the biggest things they do is provide deep psychosocial support, helping patients process that intense grief, anger, and pure frustration that naturally bubbles up when you suddenly lose your independence. And I really want to highlight this next point because it's vital. Nurses aren't just treating the person sitting in the hospital bed. They are actively educating the entire family. A successful rehab journey means making sure the family knows all about self-care, safety protocols, and what kind of home modifications are going to be needed once that patient is finally discharged. Empowering the family is exactly how you guarantee better, safer, long-term outcomes at home.
But look, let's not sugarcoat it. This is an incredibly tough job. The pure physical demands of constantly lifting and safely moving patients, it's exhausting. And that's matched by the heavy emotional toll of navigating really complex cases and absorbing severe patient frustrations day in and day out. These nurses are constantly walking a tightrope, trying to be a relentless advocate for their patient while also managing realistic expectations, all while keeping up with rapidly changing medical tech. It is a lot.
Which leaves us with one final thought for today's explainer. When you really sit back and consider the profound physical and emotional weight placed on these dedicated professionals every single day, how completely different would our healthcare system and the lives of literally millions of patients be without the daily heroism and the unwavering grit of rehabilitation nurses? It's definitely a question worth pondering as we appreciate just what it takes to guide someone on that journey back to independence. Thanks so much for joining me, and I'll catch you on the next explainer.